join us, that would be wonderful. And we are also having new physicians that have joined the Lee Health Coconut Point team upstairs. We have a new cardiologist I actually met this morning. He reported for his new day, didn't know where to go. That was fun. And then we have a couple new primary care physicians upstairs. One started last week, Dr. Lori Williams, and then there's 2 men coming on board as well. So if you need a primary care doctor and you don't have one yet, come see us. We can help you with that. Do we have any quick questions before we get started today?
I do.
What's that?
Just in case we need a microphone.
It should be in there. Is it on? There you go. Aha! Okay.
Very exciting.
So we're going to get started. Sorry, I have a little lack of sleep. I'm 4 hours of sleep. Amanda is from Senior Blue Book, and she works jointly with the Healthy Life Center here and then also our Cape Coral location to bring these presentations to you guys. So she's going to introduce the panelists today.
Yes, absolutely. And I want to thank Lee Health, as always, for their letting us use their facility. If we can give them a round of applause. Thank you so much. Okay, so I have a few quick housekeeping items as well, and I know some of you are my regulars and you always give me a little giggle when I ask about the Seniors Blue Book. But how many are first-time participants here today and have not been to an SBB program? Oh, wow. Okay, just a few of you then. Well, inside your bags, you all have a copy of the new Seniors Blue Book. And I say new, I'm actually working on my next annual edition right now, but this is what it looks like. And inside the booklet are several more of these presentations that are happening throughout Lee and Collier County. So you'll see about 6 different flyers in here. And I do want to draw your attention to one in particular because I printed the date wrong. Yes, I did. So the first one that you see in here is not on Labor Day. It's actually on September the 4th, not September the 2nd. I did scratch through that, but please don't show up down there on Labor Day. They will be very mad at me. So, how many of you are familiar with the Seniors Blue Book that are new today? Okay. How many of you know how to use it? Yeah. I asked that question because a lot of people wait until they're in a crisis before they pick up the book and they read through it. But I want to make sure you know that it's not just for crisis care. There are resources in there for aging in place in your home. There are resources in there such as elder law attorneys, everyone that you see up on the panel today, and their services that are included as well. So the first half is an A through Z directory. So in alphabetical order, you'll have hospitals, doctors' offices, physicians, audiologists, ophthalmologists, vision resources, things like that. And Lee Health actually has a beautiful 7-page spread right in the middle. So everything that Lee Health provides, you'll be able to find it from inpatient, outpatient therapy to all of their physicians. And places like this, the Healthy Life Center, are included in there as well. In the back half of the book, we have the grids. And this is when you're searching for home care or home health care options. The grids allow you to compare these services apples to apples. So it's a very handy tool that can tell you starting price ranges, if they have 1 bedrooms, 2 bedrooms, when you're getting into the skilled sector, if they have semi-private or private rooms, their starting price ranges per day for things like that. If they offer adult day services, there's a lot of information that is put just in those last pages of the book that are very, very valuable. And obviously I love to talk about it, so if you have questions about the book itself, I can help you navigate through it and help you in any way that we can. All right, so without further ado, we're going to introduce each of the panelists today. One thing I will tell you is we are a very casual, interactive group, and we like for you to ask the questions. So today's questions that are pre-designed are simply just to open up the dialogue and get the conversation flowing. And as most of you know, you'll be doing me a huge favor if you ask your questions, because someone else probably has the same request, but they're a little too shy to raise their hand. Okay, so do me a favor and ask your questions. All right, we're going to start with Susie. Susie, you want to tell them a little bit about yourself?
I'm Susie Hawley. I don't think I need this.
Well,
okay.
You gotta be considered.
I'm Susie Hawley, and with my partner Margaret Holt, who's in the back there, Raise your hand, Margaret, please. We were college roommates, and now we're into trouble again because we're trying to help seniors find the right living facilities in Collier and Lee counties. And we've researched all of the facilities very carefully. We know lots about them. And so when you have a question, or if you decide you want to look at some of them and tour them, please give us a call. Our brochure is in your little bag of goodies. Okay.
Thank you, Susie. Hi, everyone. My name is Angela, and I am the Community Liaison Director for Care Right Incorporated. And what is Care Right Incorporated? Well, we are a concierge senior pro planning company. Like Amanda mentioned, the worst time to plan for a crisis is when you're in the middle of a crisis. So we want to avert that. We want to help you plan for that crisis. We're also patient advocates. A lot of the snowbirds down here, your children are scattered all across the country. So we help with doctor's appointments and the eyes and ears when you go to the doctor. And we also help with caregiver burnout. And if you don't know what that is, you're lucky. So.
Good afternoon, everyone. My name is Sandy Gravadoni. I am a senior move manager and owner to Senior Move Management. My company specializes in senior move management from room by room sorting, tossing, donating, auctions, as well as relocation and new home setups. Our service is to help minimize the stress that comes with relocating from your home into a senior living community and or out of state to either family members or other senior living communities.
Hi, my name is Jan Wallace, and I'm a senior real estate specialist. I don't consider myself a normal realtor, okay? I don't come in and just sell your house. If you need help with anything, if you need referred to a patient advocate, to a moving estate sale, if you want somebody to, I have tons of resources, and I have handymen. Whatever you need, I have to help you through, like Sammy said, less stress in the process. I went through this with my mom and dad, and it just became a passion because I'm thinking, oh my gosh, what would they have done if I didn't move down here? So that's what I do.
Okay.
All right. So I like to try to start in some sort of chronological order, and I think that it would really be with Angela when they're coming to you and looking to have an advocate for them. What are some of the things that you need to look for, some warning signs that someone may need to make that move?
Okay, everybody, can you hear me all right?
Yeah.
Yesterday I didn't have a voice, so you're lucky today. Although my husband said honey, but anyway. So as Amanda was asking, what are some of the things that we look for? One of the things specifically is caregiver burnout. When that couple comes to us, it's either the wife that's calling or the concerned children who live out of state. They're contacting us and they're saying something's going on with mom and dad. And so we do a visitation, and if we notice that caregiver burnout is that maybe the wife, she feels so guilty that she wants to go get her hair cut and she doesn't want to leave her husband. We've seen that a lot. They feel caregiver guilt, believe it or not. So those are some of the things that we look for. We also look for signs in their home. If they're going to be staying at the home, what are their fall risks? So we're looking for something like that if there's a lot of stairs or if it's a ranch. And I know one thing, being from Ohio, am I the only person from Ohio here? Oh, there's a bunch of us. We don't have basements here in Florida. So that's one thing that we notice. If we're looking, there might be some hoarding situations going on. So that might be when we get Sammy involved, because that could be a fall issue. Trying to maneuver around the stacks of magazines and newspapers. So that's a little bit about what we do. And I know you mentioned about the patient advocate, Amanda. I was just sharing with Susie here, if your sons or daughters don't live down in here in Florida, they're scattered all around the country, I go on those doctor's appointments with your mom, with your dad, and I'm the eyes and ears. I write a report about what I saw at that doctor's appointment. I just shared a picture with Susie that concerned me very much. And because the son is not here, I'm asking the doctor, how did this happen? How can we make it not happen in the future? She goes back to her facility. I go and check on her twice a day to make sure she's getting the care she needs. She's got a doctor's appointment on Wednesday. I'm going on that doctor's appointment, and I write a 4-page report to the son, letting him know what I saw, what I observed. because it's the mother at the appointment, but the husband was also at the appointment with early onset dementia. And so maybe there's some things going on that the son didn't know about and his care provider is sharing with me. So in a nutshell, that's what we do.
Questions?
Hi, yes.
Your method of payment?
Our method of payment? Is that what the question was? We are a concierge senior, so we do have different packages. We know that senior care is so important down here in Southwest Florida, so we have different packages available. Some are a little bit different than the other, but afterwards I'd be more than happy to go over that with you, okay?
Do you want to talk about like a checklist of things that you would go through?
Oh, sure. A checklist that's something, and we do have a brochure in your bag, so that answers a lot of the questions that we get at Care Right. But some of the things that we're looking for is, believe it or not, and you guys might be aware of this, and you as well, we're looking in the refrigerator. We're making sure that there's food in the refrigerator, and it's not expired food. So a lot of people,
I've got to go.
We're making sure we're going through their list. They like to make lists, and so we're making sure that we're answering all the questions. And while I'm mentioning that, Amanda, if I can, one of the things that we are proponents for is having the grab-and-go binder. How many of you have a list of passwords by your computer? So if that medical crisis were to happen and your son has to fly down from Michigan and you're in the hospital, your wife is at the hospital worried about you, and he's like, Dad, I can't get onto the computer. What's the password? During a crisis, you're not going to remember your password. So the grab-and-go binder has all that information in here. I know we were laughing about not having basements, but think about it. Your son and daughter, wherever they are, they may not realize, oh, Mom and Dad have a storage shed? Where's the storage shed? I didn't know they had one. So there's a list of all of that is in here. Another thing that we're also checking is making sure that they have all their faculties. We're asking them questions like, what did you have for breakfast? What did you have for lunch? We're going through that, asking them questions. We're also asking about their friendships and if they're going to church, because if they're socially active, that's a good sign in our book, that they're still having their faculties, they're still leaving the home, they're still maintaining those relationships. So it's a little bit of everything that we're checking there. So any other questions? Yes, back in the lovely green.
Is any of this covered by insurance?
No, it is not covered by insurance. No, I'm sorry, but you'll find it's very reasonable. And as the son in Minnesota has told us, I'm going to get emotional here because he has used all his paid time off. And if you don't know what that is, nowadays it used to be you worked for a company, you got 2 or 3 weeks vacation. Well, now the employees, your sons and daughters or your grandchildren, each hour they work, it's accruing paid time off. You can imagine that son or daughter that's used all their paid time off because they've been coming down to Florida to check on Mom and Dad. They've used it all, they have nothing less, and that's also creating stress in their family as well because you've got to leave again. So the son, as I was telling you in Minnesota, he said, Angela, I would pay anything right now because the service that you are providing for my mom and my dad, it's just, I can't even tell you how much I appreciate it. Susie can tell you, I shared the picture with her. The one patient had a horrible sore on her arm. It had turned green and black from being in a facility. I went to the doctor's appointment with her. He's shocked. I stayed for 2 hours while they cauterized it. They made sure the sore was okay. Before she left, it looked so much better. The next day I went to the facility to check on her just to make sure, is this dressing getting changed twice a day? And I'm letting the son know that to give him peace of mind. I don't think you can put $1 on that, but that's just me. So, any other questions? Okay. Thank you, Amanda.
Kind of one of the programs that we had a couple weeks ago was if you live alone, how to plan for aging if you live alone. And I would consider this company as the daughter or son that you don't have if you're a single senior that may have the no one helping you when you get older. That could be me. I don't have children, and my dogs are not going to be able to help me get into a place. So just bear that in mind, that this company really is kind of like that loved one that, or it takes the burden off of your loved one that may live in another state if you want to have an advocate right here in town. Okay, so now that you have found someone to help you with your daily activities, and Angela, I think when you make that decision, maybe she's coached you chronologically, your next stop would be your real estate agent. And when she's coming into homes, she's looking at the bigger picture as well. So Jan, tell us a little bit about how someone with a senior real estate expert can help that next phase.
Well, as I said before, I'm not your normal realtor. When I first meet with someone, I ask them, do you have all your legal papers done? Do you have your, your trust and your wills and all of that? Because that is huge. That's one of the biggest problems I run into when it gets to closing and then the papers aren't correct. Sometimes if you don't have it filed right, you have to get a guardian, it has to go through probate. So it's very, very important to find a good elder law attorney, which I refer 2 or 3 of them to people. The next one I ask, are you a veteran? Do we have veterans here? There is a, yes, thank you for your service. There is a pension from the VA called AIDS in Attendance. Has anyone heard of AIDS in Attendance? Very few people have heard that. I talked to 150 veterans about a year ago and not one person raised their hand.
Wow.
My mom and dad got AIDS in Attendance. It saved our lives. I mean, it was incredible. You have to qualify for it. You know, there's certain qualifications, but once again, I could refer you to someone that is certified. You don't want anybody to fill this paperwork out. You could go to the VA and get the information, but do not have them help you through the process because they won't tell you everything that needs to go on the paperwork. And you'll only get 50% of your benefit instead of 100. So it's very important to go through somebody outside of the VA. And the other thing I do is I work a lot with adult children. Especially if they're up north, I work with a lot of the elder law attorneys, and they refer me to the adult job that's painted. Maybe you have to have sink repaired or whatever you're doing to prepare your house to sell. I go in and I'm their eyes and ears. I make sure the work is done properly. I've brought painters back 2 or 3 times going, you can see right through that wall, put another coat on it, where that way they don't have to fly down here and check everything. Basically, I'm their eyes and ears for any of the work that's being done. Also, just so you know a little bit more about me, and it is in the packet in there, I did win a national award from the National Realtors Association for my outstanding service for my seniors. So I was very honored and pleased for that. So, anything else?
Award-winning Jan Wallace.
Thank you, Jan. She doesn't just help seniors. She was my real estate agent as well. So, for all of you out there, yes, sir.
I have a question for you.
Sure.
Do you only do your services for seniors that are moving, or can you?
Oh no, I do. Like a lot of them are downsizing. Some people are buying. I've worked with a lot of seniors that we sell their big house, and then we find them a smaller house or condo, or So no, I don't work with just seniors. Like Amanda, I helped Amanda buy her house.
Like you can help with
I was just going to say that.
downside.
Oh, yeah, whatever. Oh, okay, absolutely. If you have a question about something, feel free to call me. I will come out, and even if you don't sell your house, I'm so passionate about it. I think it's very important that you get the right answers, you get to the right people, because there's a lot of people out there. I wouldn't let my mom and dad sign anything or do anything unless I knew who it was, because, well, you know how it is out there.
Yeah. So one of the things that Jan probably would recommend if you're not moving and you just want to organize and downsize would be to meet with a company that we're going to talk about next, which is Sammy's company at Senior Move Management. So why don't you go into detail about the services that you provide other than just the packing and moving?
Okay. So as a certified senior move manager, just to give you a little base of where the certification comes in is I belong to a national association, which is National Association for Senior Move Managers. They require for certification that the move managers actually go through very rigorous courses on alzheimer's, dementia, hoarding, and moving. So when I set up a complimentary consultation with a client who is looking to move or maybe considering doing some downsizing because they want to age in place, we go out and we determine, are they moving, are you looking to age in place, and then we go from there. So if you're looking to move, then we start looking at the floor plan. If you know which community you're going to, there is a floor plan. We start looking at the furniture, the items that you want to take with you. We always focus on what you want to take and not what you're not so much interested in. Because that's the important part, is to making sure those items are going to fit in the new home. The same with when it gets to personal items or china and things of that sort. So we do room by room sorting. We do the tossing. We also donate. Some individuals prefer to donate items. Others want to help try to offset some of those expenses of moving into a community. We do auctions. We do online auctions. We're partnered with a national company to do that. We come in, we do all of your packing. We keep our teams very small so you don't have 5 people in your residence at the same time. Our teams are anywhere from 1 to 3 individuals in a residence at that time. When we bring in more than one person, that means we've already done the room by room sorting and we're now focused on maybe doing some packing. We are packing things that either are moving locally and or out of state. If you have heirloom items that you need to ship to grandchildren or children, nieces and nephews, we take care of that for you as well. So when we come out, we're sitting with you at least usually about an hour, sometimes 2 hours. We never rush our consultations because that's where we're going to get the most information from you as what you want to do. We want to keep your needs and wishes a priority. And the important thing about when you hire a senior move manager, you're getting to make those decisions. We do work in cases where we're working with power of attorneys and we're going through them as to who's making those decisions, but it's best when you can make them yourselves. Once we've done a move, we do come back in and we do the unpacking and we also set everything back up for you. We go anywhere from hanging artwork to hanging televisions. And that also includes if you're leaving the state. If you're going to another state and you've worked with us and you want us to have someone on that end receive the items, unpack and set everything up, we do that often. We all work throughout the United States amongst each other. Right now I have a client going out to California this week, and that senior move manager and I in California have been communicating the entire time on a floor plan, on an inventory of what's arriving, what's in the boxes when they get there, what's to be unpacked and put where it's going to be put. So it's very detailed, and again, it minimizes stress. Your children don't have to take time off to come in and help you pack. Your caregivers don't have to help you pack. That's what we have senior move managers for, is to do the job for you and make this transition an actual enjoying experience. Any questions? Yes, sir?
Yes, Sammy, have you or Jan ever been involved with individuals that may want to combine households?
Yes, actually, yes, I have. I've actually had quite a few of that situation.
Be gaining popularity.
Yes, it is. It is. It's actually very popular. It's actually popular for a particular community that's in the area that I do it the most for, and that is not a problem. So let's say you do have 2 homes that you're merging into one home, and those items that were kind of taken back to the home that you're not wanting. We've done auctions for those types of things, and then Jan has sold, the home at the same time. And when Jan and I do work often together on jobs and things, her and I are communicating the whole process, if there's an auction involved, if there's a sale or cleaning of the home. That way everybody knows what's going on. So, hi.
What is your fee schedule?
Our fee schedules, we do not have a base fee. Reason being because every move is different. Every situation is different. So we come out to the home and we go over exactly what all what all your plans are, so you know what we can do for you. And then again, it's up to you how much you want us to do. We can do everything from doing it all to just doing the packing. Occasionally I get clients that want us to come in and strictly pack. They want to unpack. They get to usually the other end and say, why did I do this?
The minimum per hour fee?
The minimum per hour fee is standards, runs anywhere from $45 to $75 an hour. And again, now when the higher end, I will be honest, now you take into consideration, we do go in homes of porters. And there's a lot of work. So the higher end is obviously a little more work involved.
And once again, you don't have to be a senior to use this service.
That's right.
I literally have used Sammy and her husband to do my move, and it's worth every penny. I heard a whoo when she said the hourly. When you don't have to do that, when you don't have to pack everything, moving's stressful enough as it is. I honestly can't highly recommend a company like this enough. It takes a lot of that pressure off. So it's
And they're fast.
Yeah, very fast.
We are very quick, and we do try to do it as a flat rate. So when we come in and we're telling you, for example, during that consultation also, when we leave your residence, 99% of the time we are leaving you with a contract. Very rarely, unless we need to go back and view some photos and there's a little more involved to send you that proposal, you'll know exactly an estimated amount, and we're also putting in there the flat rate. There's a disclosure, obviously, that if there was to go over, as Angela mentioned, that storage. That does come up occasionally. There was a forgotten storage that we've been paying on for 15 years, 3 miles down the road. Well, now we need to go to the storage. So things like that is when it usually would cost a little more. But we're very upfront on that. I'll give you an example.
They packed my 3-bedroom house in 2 hours, and the next day they moved me in 2 hours with their team.
Wow.
That would have taken weeks to do by myself. So just FYI. There was another question over here. Yes, ma'am.
I'm going through something with my 94-year-old cousin, and right now she's at the tail end. We're picking her up from her home in Northport, which is an hour north of here, and she's going to move near her son, her only child, who's in Michigan. But now this woman is as sharp as a tack. She was a businesswoman. She was the legal secretary in New York City. She still traded her stocks. Very, very independent, which is why her son didn't realize that this whole move and this whole transition is so overwhelming for her. So that I knew she didn't want me to call. I finally did because I'm helping her by phone. Because we can't get it, it's an hour up and back. Yeah, that's a little bit of a distance, and I don't want to do it alone, so I have to make my husband. But I finally told your son when he's telling me, oh, Mom's okay, she can handle it, she can handle it. I said she cannot handle it. I said I did a move similar to that when I was 50, and I'm 71 now. I'm stressed out to the max just trying to help her with the different details. Either you or your wife have to get down here and help her and spend at least a few days. And so finally his wife came, but that's not enough. Still, she's forgetting.
There are companies.
Well,
and now, but she could have taken advantage of all of you.
Right, yes. And the thing too is here's something to keep in mind and children do love to help you all. We love to help our parents, that's what we do. But sometimes everything has an emotional attachment. So when you're bringing in a senior move manager, there is no emotional attachment to those items. So there are stories. We hear all kinds of stories. We shed tears. We laugh. Sometimes when the children are here, as Angela mentioned, they're on a time restriction. They don't have time for stories. Not that they're trying to be mean, but they've heard the story 40 times or what have you. We kind of come in like surrogate daughters and are there to help get the job done, to listen to all those stories, because to us, we've never heard the story. So we do listen, but at the same time, we're working and we're not emotionally attached. So sometimes we can go in at other angles to reason as to why we usually do not move china cabinets. And china cabinets don't sell, but most people like to take china cabinets to the retirement community. They do, and we take them sometimes. But, you know, there's ways to get around it without being harsh, and not that they mean, by all means, they don't, because they mean what's best for you all. They are looking out for you. But generally bringing in a third party does help.
And a lot of times the adult children are in denial. I know I was for a while. And then all of a sudden, oh yeah, they are old. Oh my gosh, you know, they're not eating right. They're not, so you just think that they're always going to be like they used to be.
And that's true.
Yeah, just one more thing I wanted to add, which I was reassuring my cousin. These last couple of months, I said it's only normal. Once you get to your new apartment in Michigan and get settled in, everything is going to come back and you're going to be fine.
Right.
Because I truly believe it's just the stress in the moment.
Oh, absolutely.
It's too overwhelming, but all of you, I wish I knew about this.
Well, if she's not moved yet, it's not too late.
The moves are coming tomorrow morning.
Oh, okay. Well, hopefully then her stress will settle down and she'll be able to get things back to normal for herself. Any other questions? Hi.
What about insurance?
Yes, oh yes, I am, and that is one of the requirements with NASM, is that we are fully licensed, we are fully insured, and we are also fully bonded. And we produce that with NASM, we produce it yearly. I am fairly new at my certification, so I just had to go through an entire company audit by NASM. So they review everything, and everything is made, you know, they're checking on all of us randomly throughout the year. There's approximately 2,000 senior move managers throughout the United States. You will see the move managers stated out there a lot. You cannot call yourself a senior move manager unless you're a NASM member, because NASM does have a trademark on that. As a senior move manager, you do have to belong to that association, and that association was built by healthcare professionals to protect you all for moving.
How is that spelled?
It's NASMM, and it's National Association for Senior Move Managers.
It's on the back of your program.
Yes,
It's
yes,
on
it
the
is.
back.
It's on the back, and there's also flyers in the bags. I want to overwhelm you with it, but definitely anybody that wants to meet or get more information, they are on the internet, and you can find out more information on them too. And you can verify. That's another thing. If someone says they're a senior move manager and you want to verify their credentials through NASM, you go right onto the NASM website, find a senior move manager, you plug in your zip code. It will list all of us that are members. If you're moving out of state and you yourself want to find somebody on that end and not include us in helping you locate that, you punch in the zip code to the area that you're moving to, and the senior move managers in that area will appear.
And all of the contact information and the bios on each of the speakers for today's topics are on the back of your notes pages. Okay. Any other questions? All right, so now we're moving down to our senior relocation expert. And I know Susie's got kind of a different little twist on her presentation today. So we're going to let her tell you about that.
Thank you. Well, as many of you know, there are probably over 100 senior communities in Collier and Lee counties. And it's overwhelming. So Margaret and I decided that we would try to get to know every single community. And it took us about 9 months going to every community and getting to know them. And then we would try to help the seniors in the community find the place that meets their needs. We meet with you initially, have a little consultation, and by the way, our service is free. If you choose a facility that we've taken you to, then the facility pays us. So we let you know, we looked for about 3 or 4 facilities that will really meet your needs. And then we tell you about those facilities and the ones you want to look at. We set up tours and we take you on the tours. So that's how we do our job. But today, we decided to do something sort of fun. And each of you has a little packet in your goodie bag that looks like this. We thought we would do a personal assessment quiz and find out where you are on your journey to maybe move to a senior living community. you've got inside our brochure a piece of paper, and on the top of the paper is our logo and our pictures, of course. There are 8 statements on this paper, on the top of it, and we'll go through those together. You guys don't have one, do you?
No.
Oh. Well, I'm going to... Margaret, do we have some more to pass to the panelists? Because they'd love to see those. Okay.
Susie,
yes.
Does American House as well as the CCRC pay your fees for moving?
Yes. Yeah. If you choose one that we've taken you to. And of course, we're going to try to make sure that we fit your needs. So we hopefully will take you to the ones that are right. Yeah. Okay? It's the paper inside the brochure. There. Okay. You'll see that there are 8 statements, and we're hoping that this will help you determine which statements are true for you, and will help you gauge your needs and desires and give you an idea of the time frame regarding your interest and need for a senior living community. Let's start with number 1, very difficult. In here, we're going to say you and your spouse, and we mean you and your partner, or maybe it's just you, but I'm going to say you and your spouse each time. So you and your spouse are over 75 years old. And if that's the case, then circle the number in the right-hand column. But I know nobody here is over 75 years old. So nobody will be circling that column. Okay. The second one is, you and your spouse plan to live full-time in Southwest Florida. If you don't plan to live full-time in Southwest Florida, if you think that eventually you're going to move closer to your kids or to friends who live someplace else, then skip this. But if you're planning on, if you think that you'll live the rest of your life in Southwest Florida, then go ahead and circle that number in the right column.
Even though you have family.
Yeah. If family isn't in the area, as people have already mentioned up here, it's so hard. You know, we work with lots of kids that are out of town, and it's very difficult. Okay, number 3. You or your spouse have been diagnosed with dementia, Parkinson's, cancer, or some other chronic illness.
Question.
Yes.
Is there anybody around that's certified to give a test on the degree of dementia?
Yes, there are people, and we can talk about that. There's a doctor called Dr. Justice in Naples who deals, and there are other people too, and we can give you some names afterwards, okay? And I bet Amanda knows a lot too. Okay. Do you want to tell some names?
I don't have any names,
okay.
But we have a dementia checklist.
Okay, okay. They have a dementia checklist too.
There's even a memory mobile that goes around from the Alzheimer's Association, and that they have that at events all the time.
Yeah, I just signed up for one.
Yeah. In the book, there's an ad for the Alzheimer's Association, and if you want to give me your information, I can put you directly in touch with them. That's something that they do regularly.
I actually did that, and it was, yes, I signed up for it. And one of the things that they have is they have these shoes with bumps in them.
That's the virtual dementia tour.
Oh, that's the, oh, okay. And that was very scary, yeah.
Oh, the virtual dementia.
Very challenging.
Yeah.
Very challenging. Wanted to see if I had it. I already knew, but. So anyway, now with number 3, when we're talking about that, if you're in an assisted living or a memory care facility, you have nursing services, professional nursing services by licensed professionals, and you have round-the-clock care with a trained staff. Now, if you're in the independent living side, of the community, you won't have that kind of health care, but they do have doctors who do rounds. And I didn't mention this before, but you know, if you know about the CCRCs, they're ones that you have to put money, quite a bit of money down at first, but then you have to pay monthly. But the thing about the CCRCs is that you will have lifelong care. It stands for Continuing Care Retirement Communities. Okay? But we have many, many communities here that have independent living, assisted living, and memory care that are rental communities. And you can move from one area to another, or in some cases, if you're going into assisted living and you're living in an independent apartment, they have provided for you to stay there and have the assisted living help in that apartment. There are a few communities that do that. Any questions? They're in the Seniors Blue Book. All the facilities are in the Seniors Blue Book. Yes.
You know what I'm interested in, and my husband is, when we get to the point, and you miss Phil.
Of course, you're not 75, so I know you didn't circle
Yeah,
that.
I'll be 72 next month, and he's 76. But we're still good. But we're hoping to be able to get somebody to live in with us. We have a big house, and we have this one section. It would be a whole suite for that person. But hoping to be able to do that when the time comes, if we don't necessarily need to be in a senior.
Have you toured a senior community before? Have you been to any of them around here?
No.
They are so much fun.
They're big surprise.
They're very, very nice.
Yeah.
I'd move in.
Well, that you can give me a call and we'll talk about it,
I mean,
okay?
I'm ready to go. They're beautiful.
They are.
So one of the
Yeah.
talks that
See
are
you.
coming up in your brochure in the bags is senior living options in Southwest Florida, and there's a representative from an active adult community, an independent, an assisted, a memory, a CCRC, so that would be a really good one. Do you know where it is? Yes. It says options on the flyer. This one's down at Collier County Museum.
Oh, she's incredible.
This presentation is at the Collier County Museums, but I do them all over. But that's what this one looks like.
But what if we want, I mean, we love our home.
Sure. And trust me, there may or may not come a time where that's not an option. You know, it just depends. If you could afford 24-hour live-in care, if you could afford 24-hour live-in care, by all means, you can do it. And there are a million companies that would love to do it.
Yes.
Oh yes, in-home care. There's a whole section in the book on in-home care. All these purple grids, these are all companies that will come and live in your home. It is very expensive, but if you can do it, absolutely.
We have a question over here, I think, too.
I have been looking for a place of independent living, but my husband has dementia and he needs help, and I haven't been able to find a facility that would take me and my husband in the same apartment.
Well, let's talk a little bit after the meeting, okay, today, and we can see if we can help you find something along those lines.
It's a very unique circumstance.
Yeah. Very unique.
There's one.
Well, I'm thinking about Terracina actually, but you know. Okay. Let's.
On the same campus, yes. In the same apartment, it's rare.
Yeah.
And I'll explain to you why.
Should we go on to number 4 about caregivers?
Yes, ma'am.
Okay. You or your spouse are the caregiver and are experiencing health issues yourself, physical or emotional. And if you're not a caregiver, you can skip this. But if you are a caregiver, believe me, I know because I was for 2 years. And it's definitely a labor of love, but it's exhausting. And if you decide that you want to go into a facility, you have people there that can take over the tasks that you were doing yourself at home for all that time. And then you can revert to being the spouse or the friend that you were before. And I know that sometimes the person you're caring for sort of resents the fact that you're doing everything for that person, and that makes things difficult too. But if you're in a facility, then you have people that can take over all those tasks. So if you're the caregiver, circle 4. If not, we'll move on to question 5. You and your spouse are feeling alone and or isolated. Now, some people prefer being alone. They'd rather be in the apartment by themselves, reading, watching television, listening to music, and maybe just occasionally go down and have a meal. But if you love to be around other people and like lots of activity, these Disneyland places that Amanda was just talking about are absolutely for you, because they have hundreds of activities going on every month. They have things like bocce ball courts, they have theaters, they have
Beauty salons.
Beauty salons, they have craft rooms, pickleball, three-par golf courses. They have everything. They have craft rooms. Yeah. Making it sound kind of fun. So those places are probably for you. Now, everyone except one that I know of has a swimming pool. And they do aquasize, and they all do exercises all the time. And all the ones I've seen have gyms as well. Some are huge gyms, some are small gyms, but they want to make sure that you stay healthy as long as they can keep you healthy. And of course, they're getting the money from you too during that time, so that's okay. Let's move on to number 6. You and or your spouse find cooking and cleaning to be burdensome. Here I am right here. having raised boys and 3 meals a day for how many years. Oh my gosh. So if you're in assisted living, it's mandated that you get 3 meals a day, assisted living or memory care. And there are a couple of independent living places that actually give you 3 meals a day. Many places, though, if you're, for instance, at a CCRC or some of the other places, give you like a meal package. They'll say you can have maybe 20 meals a month, or they'll give you a $500 ticket and say, and I'm just pulling these out of my head, $500 ticket, and you can eat lunches, dinners, whatever you want. You can have guests. Yep. And you can have guests come in. The only thing is that they don't provide alcohol in that $500 ticket. And there's lots of alcohol, by the way, in these places too. The first time I went into one, and they're talking very excitedly about they were going to have a happy hour in about 15 minutes, and I'm like, what? There are bars in all of them. Okay, so let's go on to number 7. You and your spouse are forgetting medications every day, personal hygiene, preparation for meals, etc. Well, getting a haircut isn't a problem, because as Angela said, they've got beauties and barbershops in every single one of them. They also, if you're in assisted living, that's one of the things they do. They help manage your medication. They do anything you need. Now, there are levels of care, so in most places you have to pay, for the extra help you're getting, but they manage your medication. They can help you with grooming. They can help you with showering. They can actually accompany you to meals, anything like that. So, if you're feeling any of those things, then circle that number, okay? Everyday transportation. This is number 8 and the final one. Everyday transportation to the grocery, the doctor, etc. seems challenging. Well, transportation is provided at all of these places, and it's usually limited to a certain number of miles. But they're pretty generous. They take you to Walmart, Publix, Target. They also do private drives to your doctor. And also, I didn't mention this before, but these places all have excursions. They go to the theater, they go to the Phil, they take people out for lunch, all sorts of things. And so you don't really need to have a car at all.
Trips to the doctors, are they?
Yeah, and they're no extra cost.
A lot of times they have certain days that they go.
That's right.
Doctor days.
Yep.
And as long
like they'll say Monday, Wednesday, and Friday you go to Publix, or you can go out to lunch, or you can go to Target, or you can go to Walmart, and you have to sign up for the trips. And then Tuesdays and Thursdays they'll say, okay, these are for doctor's appointments, and then they'll take you to your doctors on those days. Okay, now we've gone through all 8, so you need to now add the circled numbers and figure out what your total is. And now I have to put my glasses on because I have to read what I said in the end. You see from the results, not if, but when it's the least urgent, when it's time. The least urgent is becoming aware, followed by time to explore, and then start soon to gain a strong understanding of the senior facilities that meet your needs. This exercise is designed to give you more lifestyle options in your senior years and help you avoid running out of time and having fewer choices. And if you have questions, I'll be happy to answer anything you need to know about, if I can, and if I can't, we'll ask Amanda to answer it. Okay.
Susie,
yes.
Can I
please
take on this? Can I have that real quick? The microphone?
Sure.
Oh.
I didn't know what you wanted to take on. I was trying to figure out.
Here, so I'm going to take this a little step further. You are in Lee and Collier County, correct? Do you ever do Charlotte or
No,
out of
haven't.
the area? One of the things that we do, we talked about earlier that our children are scattered all across these wonderful United States. There's a couple that I'm working with that live in North Fort Myers. They're both ambulatory. They're still in pretty good health. However, that being said, they are cost. We've got Virginia, Michigan, and Texas. So what I'm taking what you do a little step further. The daughter in Texas says, well, maybe I want mom and dad to live close to me. So I get the list of the zip codes, and then I create a community matrix. I'm going through the zip codes. I'm seeing those facilities that are in that area, and then I'm taking it a step further. I'm checking on the Medicare checklist to see if that facility has any dings on its record. And if it does, I'm including that in my report, because she said to me the other day, she goes, well, there's a facility that's right down the road from me that I think mom and dad would be perfect at. And I said, yeah, but they also got 10 dings on the Medicare checklist. You don't want your mom and dad there. So we do that. I know more about Virginia than I ever wanted to because I had 30 zip codes that I was checking. But you find, and Amanda, you might concur with this, is that per zip code, you might have a lot of the same facilities that are in that contiguous area. So I might be searching one zip code, but maybe another zip code is showing up in that area. So again, I'm creating that list, and I'm telling them these are the good places. They don't have any dings on it. And so I'm preparing these reports. I'm sending it to the 3 children, and it's funny, and maybe you guys can agree to this up here, but how many of us have children? Well, if we've got boys and girls, and you've got boys, it usually falls to the daughter to take care of mom and dad, to find out where they're going to be living. The son, who I said lives in Michigan, I'm going to be paying for it. I don't want to be in the decision making. So that is something that Care Right does. We prepare those lists because we want to give your children as well as you a peace of mind.
We do that too, actually. I've just done 2 of them.
And I want to say something. Just every community, the state, when they come into a place like this, they're looking for problems, and not every ding is a ding that would avoid you from moving into a community. Here is this. It's not Medicare. It's the state of Florida, the ACA website, and I do highly encourage you to check out the ACA website before you move into an assisted living community. This is for licensed communities where you can see what their deficiencies are. But having, not closing the door to a fire exit is a deficiency. But is that something that I would tell you not to move your loved one into a community because of? Absolutely not. It's the state walked through and they forgot to close the door. So just before you write them off onto the bad list.
We usually, if it's 5 or more.
Sure, yeah.
That's
And
when
I'm
we're-
sure you're looking at what
Oh,
they
yeah,
are.
absolutely.
I look at the fine. I look at the fines
Yeah.
that
Oh,
they
yeah.
incur.
So this is all public information for you, and I highly, and the good thing about having a company like Angela's and like Susie's is they're doing that research for you, so you can actually be a mental support system to your family member, and you're not having to go through and look at every single one of those as well.
That website.
ACA.
Can you spell that?
ACHA.
AHA.org.
AHA?
Yes, it's
I-
AHA.
It's AHA.
I think there are 4.
And I think it's
I
.org.
think it's, yeah, Accredited Healthcare Administration.
Yeah. Sure. I think Jan has something to add as well.
The other thing, some people need to sell their home before they can move into a community. And I've worked with many people that needed to do that. Or maybe they have to cash in a, retirement account, and it's going to cost them penalties and interest and everything else. Well, I have a company that will give you a short-term in 24 hours. They'll approve you in 24 hours, give you a short-term loan until we sell your house. And then, whether it's 3 months, you need it. I think the longest they go is like 3 years. But it's so helpful. It's amazing because it's a lot less than your penalties and interest. Plus, if you need to move, you can go ahead and move, and we can sell your house and you pay it off. Some of the communities, they pay your interest. So,
It's good to know what services are out there, and that information is also in the Seniors Blue Book under Jan's ad, the company that she's referring to, if you want to do some research on it.
yes.
Jan, the short-term interest rate and the closing cost for the loan is approximately.
It depends on what community you're looking at to move into.
No, he's talking about on the loan.
That's what I'm talking about. But some of the communities have deals with this company, and your interest rate is lower. I don't know anything about the closing cost. The interest rates, it's not cheap. It's not 3 or 4%. It could be, but once again, some communities pay your interest, so you don't have to worry about it. But I think the interest is somewhere between 7 and 12, depending on.
Is that considered a bridge loan then?
Yeah.
Exactly.
Yeah.
Exactly.
Amanda, I think that ACA is AHCA. Did we say ACA or
It's
AH?
Accredited
Yeah,
Healthcare
AH.
Council.
Yeah.
Yeah, it's the state of Florida's.
I'll tell you in
Any
just a
other
second. I just looked it up.
I can't look it up because my phone.
The Agency for Healthcare, and that's
Yeah.
what the name is.
And then what's the A at the end for?
Well, I'm
Google
gonna.
is a beautiful thing.
It is, isn't it? I'm looking it up right now so I can tell you. Agency for Healthcare Administration.
I do also want to bring Care Right back up because she's got a really good point about even if you're moving to another area. One example I really like to give when we're talking about Care Right Inc. is you brought up passwords, but how many of us have a long-term care policy, for example? How many of you have a long-term care policy? Okay, not a lot. All right. Well, if you did, just say, and something happened to you, do your children know about it? Have you prearranged your funeral? Where is your documentation for that? There is so much information that is going to have to be passed down to whoever is taking care of you, like your healthcare proxy, that people just don't think about. And the binder that she has with her today, this is an organizational tool that will allow your family to have access to all of that information that I think we need to spend a little more time kind of going over. So I want you to talk a little bit more about that. Maybe pass it around, yeah.
Do you want to tell the story about Annalie? About Annalise and the bus that hit her when she had it?
Well, yeah, Annalie Kruger. She is actually the picture on your flyer. If she could replicate herself, she would be in 10 places today. So that's why I am here. Annalie had to be elsewhere. But what Susie was just talking to me about, we never ever know when that crisis is going to happen, do we? We know it's coming along the way, but we just don't know when it's going to happen. No. Well, Annalie Kruger, I actually hold her and Amanda up on a high place, and no one else can touch them because they are so amazing. And he's agreeing with me.
And Adam.
And Adam Corcoran, if you know Adam. So she was asking if I was going to bring up the show about Annalie. She is an international speaker on aging plans, on having a senior living plan in place. She was in Beijing, China, at a conference talking about how important it is. It's not just unique to the United States. She'd come back, she was in Sheboygan, Wisconsin. It was 2 days after she'd been in China. She's waiting for the sign to cross the street. She's crossing the street, and the distracted bus driver had her head turned, talking to the kids. Annalie is in the crosswalk and completely plowed over her. And so she, even though her nose, her mouth had been moved on her face, she still had the wherewithal. The witnesses came over and she said, "You know my name. This is my birthday." So she assigned them each a role. So when the squad got there, they could tell the squad what she had shared with them. By the time the squad got there, she was unconscious. But she had the binder that's going around the room now. She has a miniature her parents, their information, her siblings, so they could be contacted to find out what had happened. Now her situation, that's never going to happen. I'm going to say that, but hopefully none of us get run over by a bus. But we are going to have a crisis. Now, one of the things that I wanted to talk to you today about is planning. When I say the word plan, how many of you are just like, "Oh, I'm done planning. I'm retired. I'm done with it." I see a lot of heads that are nodding, but think about it. Your whole life, you have been planning without realizing it. Maybe not so much when you were little, but when you were in high school, you were planning, am I going to go to college? What's my education going to be? Maybe you don't go to college, you're in the service. After you get done with the service, you meet your significant other. You plan that wedding. Well, she plans the wedding, you get to enjoy it. And then you're also going to plan on how many children are we going to have? Are we going to have children? You may not realize it, but you're planning all of this. And then as time goes by, you're not planning anything. Maybe when you're going to have bridge night, go out for cards or play golf. But you're also planning on your retirement. And that's why so many of you are living down here in Southwest Florida. You planned for your retirement. Another plan that, since we live down here in Southwest Florida, how many of us do hurricane planning? I was teasing Amanda earlier. I said, have you heard anything about Darien? Do we put up our shutters? Do we evacuate? That's planning. But the most important planning you can do is for you. Have you got a plan in place? Right now, you are all look very healthy. So now's the time to do it, because when you're in a crisis, and I'm sure we can all agree on this, you make bad decisions, you spend too much money, and there's too much emotional involvement with it. If you have a plan in place before you get to what that crisis is, hopefully that's going to be alleviated for you. And I like what you were talking about, emotional attachment to, believe it or not, during a crisis, are those emotions up there? You've got your cousin, her son is fraught with emotion right now. You've got your children who are like, I can't think about this. Well, guess what? We're like Sammy. We're not emotionally involved. We can be the calming voice. When we're doing that Zoom interaction, having a family meeting with the son in Texas, the daughter in Virginia, and mom and dad are here in Florida, we do a Zoom meeting, so we are all in one room together having that family meeting. And when those emotions get up there, and they do, we are there to say, hey, take a step back, take a deep breath. Let us help you get through this. Any questions? Susie?
We've got Amanda coming.
Amanda.
The boss.
Oh, did you have a question?
For Susie.
For Susie.
Yes.
Perfect. with all your experience and given, let's say, a quality facility that's got all the bells and whistles as far as accreditation, what, with your experience, you would throw out, say, a couple names of places that have really good services for the money? What would you say?
It's so interesting because everybody asks me that. I mean, I'm talking not about the people we're taking to the facilities because we recommend 3 or 4 that meet their specific needs. But it's funny. My dentist asked me that. My orthopedic guy asked me that. And I just look at them and say, well, it depends so much on the person. We have to know what you're looking for. And another thing is, what can you afford? And then we look at it and we look very hard at the staffing. And we tell people, there are lots of beautiful places out there. And many of the beautiful places, in fact, most of the beautiful places are really excellent. But don't buy the lobby.
Yeah.
Get in there, dig deeper. But that's what we've done. That's why we're not going to recommend any place that we don't think is going to take the care of you that you should have taken.
It's almost like picking your college, there's so many to choose from, but it's so individualized.
Yeah.
What's important to you, it could be completely
different from someone.
Irrelevant to someone else. And there's so many.
Well, I meant the ones that have all CCRC, the ones that have all those.
They're all so different too.
And which ones do you know are quality?
They all.
I have to say they all are.
They all are.
I would move into any of them in a second if I had that kind of money.
Yeah. Some of them have such different amenities. Some of them are faith-based. Some of them are not. Some of them have
nonprofit.
Some of them are nonprofit. Some of them are equity-based, where you buy into it. I mean, they're just
exactly.
I have an entire program on continuing care retirement communities next month, and there will be a representative here. Actually, it's October. There'll be a representative here from every single one of them. That would be a really
That's
good
great.
one. You and kind of ask them questions all at the same time.
And also location, where you live, where you want to live. Some people want to be at Shell Point. Some people want to be in Cape Coral.
Or all the way down at the Arlington,
yep.
If you're a Naples person. I mean, it depends on where you live too.
So
I also wanted to share the people that do have the long-term health plans, insurance. I have someone that will actually take. For those of you that have the long-term care health insurance, I have someone that will look at your plan and give you a free consultation for 1 hour.
Man, that went down fast.
1 hour consultation to tell you exactly what it pays, when it pays, because those are so different, and sometimes they're very hard to read. So, I'd be more than happy to share that.
If you look in the book, in the CCRC category, in the grids, there's a list of every single one of them that are in the area. And like I said, depending on where you want to be, I can usually have at least 6 of them up here at one time for those panels. It's a popular one. I think you've been to one of those.
Yes.
Yeah. All right. What other questions do we have?
I have a question for Susie.
Okay.
Susie, you mentioned that you or Margaret do the tours with the clients. How far in advance do they need to schedule those tours?
I really frequently can get the tours that week, the same week. So, in fact, sometimes I can even get them. I try not to do it that day because when we go back, we have to look at our database. We have a very, very complicated database. We'd go back and look at it and think about what's going to be right for these people. And then we have to talk to them and say, which ones do you think? Do you want all of them? And then we can even get tours the next day.
Okay.
Yes?
I'm going to ask on that, just a follow-up to that question. Wouldn't it be to your advantage if someone makes an inquiry to at least have some background on what they can afford? Because
we always, yes. Okay. We always say that. He asked if we shouldn't find out what people can afford if they make an inquiry, because first of all, your time shouldn't be wasted.
Right.
And also the facility's time shouldn't be wasted.
You don't want to fall in love with something.
And not be able to afford it. So that's one of the questions we
ask. And that would
ask.
be my fear, more so than the other way around. You know, if you find something that you just, I have to have it.
We don't do any in-depth financial inquiry, but we say, we had somebody who told us that he could afford $8,000 or $9,000 a month. And Margaret and I looked at each other amazed because we've never heard that for a rental community. And we found out later that he was going to run out of money in 11 months. So that was not,
A question I had based on what you said. Amanda, can you please explain, since we're talking about this right now, the monies that have to be involved before they fall in love with these communities? Like, what are they looking at?
Yeah, I mean, there's several different community options, which also is another thing that we talk about at these different presentations. Depending on whether or not you want a rental community where you have the luxury of being able to pick up and move. Looking at a CCRC, you're going to have a financial assessment, you're going to have a health assessment. If you have a diagnosis, I'm not going to say Parkinson's because there are communities that will take Parkinsonians, but dementia, for example, you're not going to be able to get in. And I'll tell you why, and it makes sense. They are governed by insurance. They are an insurance entity. Basically, if you don't have long-term care insurance, which a lot of you folks don't, you may want to consider a continuing care retirement community. I'm looking at one for my grandmother, and I know that for myself, because my dogs are not going to take care of me, that I need to look at something like that as well. But a rental was a really good option if you have a spouse, and maybe if something happens to your spouse, you may want to move closer to your children. In a rental community, you have to come up with anywhere from $1,500 to $3,000 to move in. In a continuing care retirement community, the minimum, and it's very rare, is around probably $15,000 at the minimum. And then there's places like Moorings Park where you have to pay, a couple million. It just really depends, and that's why it's so important to do your research and not rush into a decision or wait until you need it. If you wait until you need it with a CCRC, you're not going to get in.
And Amanda, there's another thing. For instance, Moorings Park, and Margaret, tell me if this is correct, but doesn't Moorings Park demand that you have 2.5 times what you put down as the initial cost?
They have to take care of you for the rest of your life, so it makes sense that they want to know you can afford it.
I have a question for
How do they do that? Do they buy an annuity for the person? Like
No.
you give them $2 million, they buy an annuity?
No, you
make
pay.
sure
You
that you
pay.
have the money?
So basically, the money that you give them, it goes into a fund, if you will. I'm not going to call it an annuity. I've been told not to use that word.
I'm sure I heard that word.
But you're buying into it, and then you do pay a monthly fee on top of that as well. And it could be anywhere from $2,000 to $10,000, depending on the community.
And they want you to have, if you pay the monthly fee, then they want your income to be 2.5 times what your monthly fee is.
And this is where I was saying it gets really complicated with that ABC contract, because some of them are 100% refundable, some of them are 90% refundable, some of them are 0% refundable to your family as a death benefit. And one community can have 3 different options for you to choose from even. It's like, it's overwhelming. There's so much information.
And each contract has a different price.
Exactly. If you don't want any money back, like I wouldn't, who am I going to give it to? My dogs will definitely be dead then. I don't need 100% refundable. I'll take the less expensive option, and just live there and have a happy-go-lucky time. What was it, Jan?
Jan just suggested something to me. There's a place for mom that you hear on TV and all over the place. And I'm asking you, please call us before you go to a place for mom, because
Remember you're on video.
Okay. We actually know you, and as attractive as Joan London is, she really doesn't know you, and she doesn't know the facilities in Naples either. They do have some counselors around, but Yes.
Like I was saying, I love Joan London, but places like that, once they get you placed, bye-bye, hope you have a nice life, we'll never see you again. And with Care Right, with Sammy, with Jan, with Susie, we know you. The facility, we're gonna stay with you. Yeah, we're not gonna say, bye-bye, you're here. We're gonna stay with you. And I think all four of us feel that same way. Jan, did you have from Sammy?
I want to add something when she was mentioning the fact that we know you. I have several clients as they've aged, needing to go from independent living now to assisted living. Some have had spouses pass, and I'm going back in and helping. Maybe we're doing a little more downsizing, or we're removing the loved one's items because they can't do it, you know, emotionally, and the children don't want to do it. And or it comes time where they've lived in these other communities here, and now it's time that they move closer to their children because they did lose a spouse. We're called again. So we build that relationship with not only our clients, meaning you, but also your children, because we're that distant family. I have a client that I've had dealings with in the last year and a half, 6 times, and now, you know, things have come about over this last year and a half that they know they can call me at any moment to just swing in and say, hi, can you run to the store and buy this for Dad? You know, different things like that. You're that distant relative to, we're that distant relative to you and to your family members or children.
Let me say something. Just a little story that I had. The sons called me there in Timbuktu, and they said, oh, my mom moved into skilled nursing, okay? And so I went to visit her, and I got there, and no one had gotten her any clothes. She had no clothes there. She had no shoes. She had nothing. And I'm looking at these nurses going, so I ran to her house, picked up a bunch of clothes for her, so, and you know, shoes, and I put some pictures out for her, and I'm thinking, well, where are these people thinking of? So I think all of us have big hearts like that. You know, if you need something, we're there to take care of it.
It's nice to know that there are professionals that are on your side like that, especially if you're in the situation where you don't have a lot of family. So today's topic was to cover the checklist of what may indicate that you need to go into a senior living community or downsize or make a move, the options of all of the beautiful senior living communities. What else do you feel like we didn't cover, or do you have questions about that that maybe you want to ask? And if it's an individual question, I usually save the last half an hour or so for that. So if you have an individual question from one of the panelists, we can do that too.
All right, since there is extra time, more on the pros and cons of getting somebody to live in your home with you.
Well, it depends on the somebody that you have.
Yeah.
You know,
if you're looking, like Susie's saying, if you're looking for a professional company, there are a number of them that absolutely. The pros are you have someone there to take care of you all the time. I guess the con would be socialization, not being around a lot of people. Can you pass that down?
When my mom and dad moved into a community, they really didn't want to move into a community, but they really needed to. And I swear, they got healthier, they got happier, and they got more independent, because the only thing my dad had to do is write a check. You know,
that's what the
month.
research shows.
And you know, they were eating TV dinners and everything, and like I said, I was in denial, and they were in Lakeland, and I went, and I'm like, oh my gosh, you know, something's got to change. And they did. They got healthier and they got happier because they had friends, you know, that were around them. And then they got more independent. I mean, it was amazing. I didn't expect that.
If you're gonna stay at home, there are tons of opportunities. Like there's transportation companies. I have a new gentleman joining that he does a chef for seniors, and he'll come into your home and cook an entire week's worth of healthy, balanced food for you.
There's also a CCRC that has a
CCRC without walls.
Right.
Yeah.
And then when you buy into that, you get everything taken care of. It's a monthly fee, it's a lot less, but then let's say down the road, 5 years down the road, and you go, okay, I want to move into community, they'll give you a discount on your entrance
That's
fee.
called Senior Choice at Home, if you want to jot that down. It's a continuing care retirement community without walls.
Is that so they come into your
It's so Gulf Coast Village is the entity, Volunteers of America.
Yeah.
But it's not in the case because it's in your home, wherever your home is.
Yeah.
Exactly. Yeah.
There's an office in Bonita too, isn't there?
Senior Choice at Home.
Yeah.
They do a lot of these presentations with us on the aging in place because basically you're paying for the services and you can go on to their campus in Cape Coral and use all of their amenities, which is awesome. And you're not paying for the sticks and bricks that built the community, you're paying for the service.
But
So-
you need to look at it while you're healthy.
Yeah.
Once again, it's healthy, because if you're not healthy, you can't, they won't, or it'll be extravagant to get in, so.
Well, Verna and Howard here, we live in the same community. I lived there with my husband for over 11 years and about 14 community started. Well, we have about 100 friends who just said that are our age, who left the community, and I thought, I would think a lot of them plan on staying.
Well, we would love to come in and do a presentation and bring Senior Choice at Home and, movers and packers and let them know what the options are out there.
You were asking about being at home, having someone at home with you 24/7.
When she needs it.
When you need it, when it's needed. Just an example, I was working, I had a lady from Edward Jones call me one day, and she said, Angela, I've got a client who is very ambulatory, but she just became unambulatory, but she's living at home, she's now in a wheelchair, and she's been taking care of her brother, who's 80 years old and autistic. And she had 24/7 care, and the Edward Jones lady gave me the amount that the woman was spending for the month for this company to be there 24/7, and she says, is this too much? And I said, well, what's the amount that she's being charged a month? And it was $40,000 that she was being charged. But this, and I'm not going to name the company, but they were providing 24/7 care. They were doing light housekeeping. They were doing cooking. They were making sure the medicine was being taken when it was supposed to. They were also driving the client to a doctor's appointment.
$7 an hour. It adds up.
It truly does. It really does. So make sure, like we've all been stressing, research. Do your research while you have your brain going. Also, Amanda, and one thing I'm going to comment on, we're talking about the ease of getting into these communities or the not ease. There's also a waiting list. So if you think you're going to get in there next week when you make the decision, we have waiting lists, don't we, ladies? And you know
There
this.
used to be a waiting.
Yeah, not so much anymore. Yeah,
There may be a waiting list to get your exact apartment if you want a 2-bedroom on the 3rd floor facing the golf course. But if you need to get in,
because we've got hundreds of communities out there, and so many are coming up, and people now are giving you incentives.
A lot of these communities, people are all moving in at the same time, or roughly about the same age.
Yeah.
And we're also aging at the same age.
Correct.
So is there any service that provides that kind of at-home service for the entire community?
Oh, I'm sure that there's a home care company that will love that deal. I mean, there's so many available that, I mean, if you built a relationship with one company that you really liked, would they love the opportunity to service everyone in the community? Sure. We could make it happen. I can tell you that.
I am ready to move in community.
Sure.
But I have not found one that will accept me in my home.
That's what you were going to talk about.
With his dementia.
Yeah.
Yeah, we're going to talk to you after. You stick around, okay?
And I think we had a question back here.
I was just wondering about the grab-and-go binder. Can you get those somewhere, or just from your
From Care Right. Yeah, we have those binders. There are some out there. They are the same principle about having all the information in a book. I think ours just takes it to that next degree where we have everything listed. And if there's something that's not listed that you, like the storage facilities, we didn't have that in our original grab and go binder. It came to us because the wife said, oh, you know, should my kids know we've got a storage facility? So it's the ideas that we get, we'll put it in the grab and go binder. But yeah, we do provide those.
So her information's in the little bags that you guys are taking with you, and you can reach out to her. She'll get you set up with one for sure. Mm-hmm. Any other questions? Yes, ma'am.
Two other subjects, but rather than have someone
Just so
come
you don't
into
miss
the home, is there any service that provides for picking up one of the members of the household just to give the caregiver a little bit?
Oh yeah,
There are.
Absolutely.
There's adult daycares and
Yep.
there's transportation, people that'll pick them up. And
There's adult day right down the street at Shifting Sands.
Mm-hmm.
Oh, it's wonderful.
Shifting Sands.
That's a good one.
It's a good one. Their information's in the book as well. In the adult day, in the A's. Yeah. Good question.
I love it.
All right, if you have individual questions, please come on up. If not, let's give our panelists a round of applause.